I am Peru Kamiura. I am IT Communication Officer in Japan. We are talking about effective use of PEEK in daily practice today. Today's agenda: introduction, patient removal bridge with PEEK and zircon bridge, full arch and unilateral, full denture and partial denture, implant custom abutment with PEEK material. This photo is our dental digital team. We are 4 dental technicians, 8 dental hygienists, 5 dentists, and 1 wife. You can see a journey with ITI. I have been an ITI fellow since 2008 and a communication officer since 2018. I like running. I have participated in full marathon race since 1998, 1995. I am a communication officer for advertising IDEA Japan activity. A president of Stroma Japan presented me running wear for advertising Stroma and ITI. I participate Olympics Games full marathon. I think worldwide people see this TV program. I can promote ITI and Stroma as an ITI communication officer. This is me. I want to introduce contribution to ITI. I have been an ITI fellow since 2008, so I posted my clinical cases to ITI website almost every day. These are my contributions as ITI fellow. This is my clinical case. If you are ITI members, you can see this slide in today.
In this case, the patient requires a periosteal releasing incision in the anterior maxillary region to achieve tension-free wound closure following grafting and simultaneous implant placement procedures. This case demonstrates the scissors technique for releasing the periosteum. A full-thickness mucoperiosteal flap has been raised with vertical releasing incisions adjacent to right central incisor and left lateral incisor. The flap is extended apically beyond the mucogingival junction. A black silk retraction suture has been used to maintain reflection of the palatal flap. Using a second retraction suture and fine tissue forceps, the flap is gently pulled buccally, providing clear visibility of the undersurface of the flap.
From then, we tried digital treatment, so we were invited from Europe, Budapest, Hungary, and Vienna, Austria. You can see the video in Hungary, Semmelweis University. For advertising my presentation. We had a presentation, digital implant treatment in Hungary, and we had a presentation, same topics in Vienna, Austria. We had online test study club every Wednesday.
Connective tissue around
Japan time.
implant contain collagen fibers that orient primarily perpendicular to the implant surface, similar to periodontal tissue folds.
Charco, attending every week.
Similar to periodontal.
Thank you for very much, Dr. Jennifer.
うん。ね。
Because it's perpendicular but not is similar.
She is very
Yeah.
famous
はい。
dentist in Peru, I think.
Which of the following statement is most correct in
I will show you about patient removable bridge. By utilizing CAD/CAM technology, materials such as zirconia and PEEK can be freely modeled with high precision. The characteristic of patient penetrative bridge, patient removable bridge, as double crowns using zirconia and PEEK for detect defect prostheses are shown below. Patients who do not want an implant surgery but want a fixed prosthesis, moderate retention, and applicable to cases involving both implant teeth. No need to extract multiple teeth or remove large amounts of jawbone with oral hold protocol. Easy to repair prosthesis, good cleanability. Ideal for prosthetics in a super aging society. But we can get AGC copying from partner dental laboratory, so we try to other materials for patient removable double crown. We think the bridge is good for cleanability. We got new milling machine, MSI Core, Stroma. We found out PEEK for double bridge milled with new milling machine. PEEK, we found the PEEK. PEEK is a member of allyletic ketone family, PEEK family. P is classified to super engineering plastic. PEEK and PEEK is top of the this family. For example, PEEK is used for car and gear, car and airplane, and used for femur and skull, and dental implants. I emphasized that elastic module of PEEK is close to dentin and cortical bone. And this is a very important factors. In this paper, zirconia combination between zirconia inner crown and PEEK outer crown shows high and consistent retention. This red line shows in 1000 cycles about 10 years daily detachment retention is stable. We decided this combination is best combination for patient removable prosthesis. You can see first clinical situation in this case. Six implants were pressed in edentulous mandibular, and full ceramic bridge was set in maxilla. This is full breach in this case. You can see definitive restoration in this case. I prayed situation lasts forever, but after 6 years, he lost maxillary bridge, unfortunately. And this is a condition of detachment of full arch ceramic bridge. This is CAD design of zirconia and PEEK bridge. This software is Straumann Care's visual. You can see the video of fabricating of inner zirconia crown and outer PEEK bridge. After digital impression, Trios CAD design of inner zirconia was performed. After designing of inner crown, outer PEEK bridge was designed with CAD/CAM software. These are the design results of PEEK outer bridge. The frame was cut back for veneering material. This is the result of milled PEEK. This PEEK disc was delivered from Shofu, Japan. One disc cost $600. The framework was milled IMSI core. You can see the retention of this bridge. Moderate retention. We find moderate retention. You can see the zirconia inner crown and PEEK outer crown. Framework was veneered with hybrid resin, hybrid ceramics, Shofu. And this is the definitive restoration in these three models. You can see the oral conditions. After setting zirconia inner crown, gingival health was improved dramatically. In my cones type crown case, zirconia crown has high biocompatibility. Hybrid ceramics, flowable resin, ceramage, Shofu was veneered to teeth and gingiva. In full smile, you cannot see the border between pink ceramic and gingiva. You can see the final results in the panoramic gradual graph. After 3 years, the occlusal surface is PEEK, but no major wear is seen. Polishing of antagonist prosthetics is essential. I have seen PEEK wear due to lack of antagonist polishing. In this paper, Abu Hai reported that PEEK does not wear out to enamel as antagonist than zirconia. You can see a blue space. In terms of material itself and the antagonist PEEK is considered to be a more ideal prosthetic material as there is less reduction in vertical dimension compared to zirconia. PEEK is better than zirconia, I think. Because hardness, PEEK is similar to enamel and dentin than zirconia. Is familiar to biocompatibility. Next case, tooth and implant combination. Patient removable double crown is PEEK and zirconia is suitable for in this case. He used removable denture and we take vital registration in 3D printer model. You can see the occlusal condition in maxilla. We made zirconia inner crown and titanium inner crown. This is zirconia inner crown. And this is outer PEEK crown, like bridge. This is PEEK bridge. And this is completed prosthesis after hybrid resin veneering. You can see the final restoration. This kind of double crown is applicable to cases involving both implant and teeth. Teeth and implant. You can see the occlusal view in this case. In this type of prosthesis, new abutment can be added. We think that for 6 implant abutment is needed in full bridge. It doesn't matter if it is an implant or a natural tooth. We can accept implant and natural tooth. PEEK bridge is easier to repair to add the abutment than zirconia bridge. You can see the change before and after abutment addition. In this case, we can confirm slight wear on the occlusal surface, and we recommend this prosthesis because of good cleansability. This prosthesis is ideal in superaging society because of needing nursing care. Next case. 4 implants were placed in posterior mandibular for fixed prosthesis 2016. Unfortunately, tooth number and implant number 36, 33, 32, 31, 41 were lost in 2021. She desired a fixed prosthesis. These are 6 years change in her dentition. Left slide is 2015, right slide 2021-22. G9 yellow crown were fabricated in teeth and implants. Peak outer crown was made to fit inner crowns. Occlusal surfaces were veneered with hybrid resin. 小風 ceramage, inner crown and outer crown. And inner crown and outer crown in 3D model and hard occlusal condition. And this type of prosthesis, advantage of this type of prosthesis advantage. Inner zirconia crown and outer peak bridge. First, periodontal health. Two, secondly, minimal invasive. And next, patient who need nothing care. Fourth, patients who reject implant treatment. Fifth, implants who needs fixed prosthesis.
Hello, I'm a dental hygienist, Alisa Morita. I would like to talk about a case of a removable peak bridge. Thank you. The main complaint was that she wanted to consult about an implant that had been treated at another hospital, and she was worried about being treated at another hospital. It seems that implants were placed in the upper and lower front teeth at another hospital and they were lost. There was no hope that an absolutely fixed type would be better. The lower jaw is a bridge. The upper right implant was unstable, so our hospital determined that it could not be saved. The resorption of the maxillary bone is large, and as you can see, the gingiva has also decreased compared to the remaining teeth. With cement retained bridges, the gums are idol-like teeth. Aesthetics are good, but cleanability is poor. We perform soft tissue, airway, and temporomandibular joint analysis. We use a software called cephalometric A to Z to perform cephalometric analysis. Next, we analyze the facial pattern. She is mesotype in vertically and slightly higher than class 1 horizontally. Next, we simulate the result of our treatment with Smile Design Trios software. As you can see, a summary of the problem and treatment plan. We made a treatment plan based on the 4 elements of occlusion. She chose a peak bridge because she didn't want implants. Implants that could not be saved were removed. Dr. Kamiura's standards for peak bridges are there should be at least 6 bases, ideally at least 8. The crown was removed and the impression was taken. That day, temporarily put on dentures with temporary. I stayed in this state for 6 days. This is provisional restoration. Set with an inner crown. Then set provisional restoration. The provisional restoration was removable and could be used without any problems. The final restoration was created. This is a removable peak bridge with a floor. It has mucosal support and is as close as possible to a fixed type. This is what it looks like when the peak bridge is installed. The areas where there was no gum on the front teeth were covered with the floor. User mouthpiece were sleeping. The mouth also has a natural smile, almost matching the smile design done in the treatment simulation. This is a video of the interview. She says that she can use it without any discomfort in terms of the fit and appearance. It has now been a year since the final set, but it is being used can be easy to clean too. Next, other cases treated with peak bridge. This is a state it is in after removing the bridge that was used for a long time. Create an inner crown. It was placed in the oral cavity. After 4 months, the condition of gums has improved. The treatment is completed by set the peak bridge. Just made it a zirconia inner crown. Didn't do anything special. This is a summary. When implant surgery is not possible, mix of implants and natural teeth. Implants from other companions. Even in such cases, treatment is possible with peak bridge. That's all. I would be happy if you could refer to it and help me even a little. Thank you very much.
Hello, I'm a dental technician, Yasuhiro Yamagiwa. I would like to talk about a case of peak cones and custom abutment. PEEK is polyethyl ethyl ketone. It has high resistance and performance. It is classified as a super engineering plastic and is an excellent material used in high-load environment such as automobile gears, aircraft, and space projects. This is a table of material convenience for the inner and outer crowns. As a result of an experiment in which the product was put on and taken off 10,000 times, it was found that the staying power remained unchanged for 10 years. It has this staying power even immediately after milling. First, let's talk about the PEEK custom abutment. Digital impression taken on the time of implant placement. Please place guards around the scan post to make it easier to perform the impression. We manufacture custom abutments and prostheses as cares visual. The elasticity of PEEK acts as a shock absorber for the implant body. Set next to secondary operation. The margin of the custom abutment was set above the limb concentrating inches of cement removal. Digital impression of a custom abutment in the oral cavity. Finally, the abutment may be formed and adjusted within the oral cavity. Next is a case where custom abutment was used as a heating cap. Additional impression is taken at the time of implant placement. And the custom abutment is fabricated and installed on the same day. Peak milling is possible in about an hour. Peak custom abutment set, the margin is set on the edge and made to that it does not hit the matching part. The joint use a value base. After 7 weeks, you will see that your gowns are healing in line with the custom abutment. We will make a digital impression of this condition and create a provisional crown. The provisional crown was set after completing the orthodontic treatment for number 7. We plan to start making ceramic. Next is removal PEEK bridge. Inner crown and PMMA outer crown. Try on the PEEK outer crown to confirm stability. Complete the processes on the 3D model. I use Cermage made by Shofu. After set, patients are also satisfied with the ease of cleaning. What to do in this case? The patient does not want an implant and wants a fixed prosthesis. In this case, her removable PEEK bridge will also come in handy. Surgery of difficult cases. Receiving bisphonous post treatment is also possible even if there are conditions such as a short crown length. In that case, occlusion can be done with an internal crown. Summary, we believe that PEEK's performance as a shock absorbing material is also effective for custom implant abutments. Also, considering the state of healing of the mucosa, we believe that there is no problem as a material for custom abutments. Removable PEEK bridge can be combined with zirconia internal crowns to provide treatment that increases patient satisfaction. Even in situations where implant treatment is difficult. Our clinic regularly uploads videos. Please also subscribe to the channel. That's all from me. Thank you.
My name is Manami Sato, and I am a dental technician. I will talk about PEEK denture, PEEK post and core. and PEEK plans. First, as case of PEEK dentures. First, let's talk about the advantage and disadvantage of using P4 dentures. Advantages are lightweight, ability to absorb load, metal-free. The disadvantage is that with a full denture, only one or two can be made for one disc. For partial denture, PEEK is a material that does not deform, so the crust cannot be adjusted so you need to create it. We will introduce these three cases. Full denture case. This is a PEEK full denture manufactured using copy denture data reflected using a method that scans the mucous membrane in the oral cavity. This is the entered dentures will be scanned with an intraoral scanner. Using CAD software, all data on the scanning denture is decided except for the mucous membrane. This is video of the data after dilution. It can also be removed using the scanner software. STL data has a front side and the back side, and in order to use the back side data at the front side, inverted the data with mesh mixer. Design a PEEK plate on top of the inverted data. After designing, we started milling the PEEK disk. The processing machine uses IMS i4. It takes about 8 hours. This is the static after 8 hours. Although it was just thin, new surface is already smooth. After pressing, drill a hole for holding. The denture was then completed using the usual denture manufacturing method. By reflecting the stable mucosa and taking advantage of the performance of PEEK, we were able to create a very good denture with excellent fit and absorption. We also manufactured colored dentures by carving our polycarbonate discs like this one. Implant over denture recovery case. This is an overdenture case using the implants and locator in the lower jaw. I use it to have dentures like this. It broke like this. When making new dentures, we decided to use PEEK, which was property of absorbing loads. First, a copy denture is made and an impression is taken. After the analog, clear the tracer, clean in and mount it on the articulator. Start making PEEK plates. The base model is scanned and the copy denture is returned to the same model and scanned. Superimport it to data using CAD software. We check the copy denture data to ensure that the plate is fit inside the denture when designing. Further modify the plate. We designed a plate this is integrated with the contains the locator main. I exported the stale data and made the PEEK disk. Adjust and polish. This denture was also completed using the NORA denture manufacturing method. The locator mail was routed into the denture using a model. The bonding material is Tokuyama Dental Company's Bond West 2. It is a very strong bonding material. This is the completed denture. The edge of the inner plate is made of PEEK material inside it of resin. It's but the material is lightweight, so you don't have to worry about it. And because it is strong and was the ability of PEEK to absorb loads, it is still being used without breaking. Partial dentures case. This is case in which PEEK was used and the request of the patient who did not want to use metal for his lower right partial denture. We use CAD software to design the plate, clasp, and artificial teeth. Convert each part, export the stale data, and mail it without PEEK disk. Adjust and polish the frame. The crown and thumbs are built up using hybrid resin and the process is completed. It was completed in the oral cavity. I have made cervical other cases, but the air still issues are adjusting the retention force of the clasp. However, I think that it is a good new option depending on how you think about it. Summary of PEEK dentures. I feel this was combining the performance of PEEK with digital technology. we can expect variety of possibility for denture.
You can see the peak custom implant abutment. In this case, two BLX implants are placed in the posterior maxilla mandibular. We take immediate impression with iOS in implant placement. And same day, we make custom peak abutment set in her case, in her mandibular. And finally, we placed zirconia crown in the abutment. Next case, we made immediate impression with intraoral scanner and impression post. And same day, we make custom implant abutment with same day, almost about 1 hours. Soft tissue was matured with custom impression abutment. We recommended peak material to your implant and other dentistry, post and core, telescopic denture, complete denture, and partial denture, implant custom abutment. We can use ground bridge, partial denture, orthodontic wire, dental implant in near future. Thank you for your attention. We are living in Otaru, Japan, and we have a yacht. Please come to Japan and please ride in our yacht. Thank you for your attention.